Hi, we are finally on our last video in the series of top 100 drugs. We have 91 to 100. Let's get started. So up first is Vyvanse. Now, this is a scheduled drug, as you can see. It's a little hard to see. That's a Roman numeral 2. Okay, so it's a C2, Schedule 2. Vyvanse is brand name for lisdexamfetamine. Lisdexamfetamine. It is a stimulant used in ADHD. So it's going to have the same profile as Ritalin and Adderall, and it is not $55. That was supposed to be a pound sign. Go up to number 55 and you can get that information. It's going to have the same profile, but what's the advantage to Vyvanse? So Vyvanse is different. It's a prodrug. That means that the body's going to convert it to the active form. That's what prodrug means. And so the way it dissolves and then your body converts it, it actually is a really long process and has about a 12-hour effect, maybe even 14-hour effect. So it works really a long time. So it's very convenient for a patient to not have to take this twice a day. And as a prodrug, it's less likely to be abused because the active form only occurs in your body. So the inactive form is the part you swallow. So if a person tries to manipulate that, snort it or whatever, it's probably not going to work as well as they would hope. Next we have Keflex, and that is K-E-F, like Frank, L-E-X, 250 milligrams. Generic name is cephalexin. It's an antibiotic in the antibacterial spectrum. And by the way, let me see if I get into this or not. Yeah, I do. Okay. Okay. So what's it usually used for? Skin infections, dog bites, cat bites, animal bites, respiratory infections, upper respiratory, so lungs and up, ear infections. Also used for UTI, which is urinary tract infections sometimes if a patient can't tolerate the other drug classes. Usually this is going to be dosed at 4 times a day. And there is a small chance, I had one of our earlier when we were talking about amoxicillin and penicillin, the cross-reactivity for someone who has a true allergy to a penicillin, there is a chance they could be allergic to this as well. I think it's around 5%. All right, main side effect is diarrhea. One of the things we do to help patients with that is we advise them to take a probiotic or eat yogurt with active cultures. Dannon and Activia are 2 brands that have active cultures. Next drug, I could not find, this brand is not available anymore, and so you're only gonna get this information here. If you Google this or you do ChatGPT, you're gonna get some, who knows what you're gonna get. You're not gonna get what's in this video. This is, the brand that we use in medical practice today is Atarax, A-T-A-R-A-X, 25 milligrams. And so doctors and nurse practitioners, they order it all the time as Atarax 25 milligrams. So it's common knowledge, but you might not see that when you go to the drug reference because it's off the market or we don't use it anymore. So the generic name is hydroxyzine. Now, something about hydroxyzine you need to know. There are 2 salts. We have hydroxyzine hydrochloride and hydroxyzine pamoate. Atarax is the hydrochloride, okay? How are you going to remember that? Vistaril is the pamoate. So if the doctor just orders hydroxyzine, the pharmacy is going to call and say, which one do you want? Do you want the generic Atarax or do you want the generic Vistaril? So this is how we determine this. Atarax is used primarily for itching or hives and Vistaril for anxiety. Now, the literature says they both do the same thing, and but you can't convince the behavioral health community, and you can't convince the primary care doctors, so this is how it is. You're going to see Atarax for itching and hives, and you're going to see Vistaril for anxiety. Side effects include drowsiness and dry mouth. Next up, we have Xalatan. Say it with me. Xalatan or Xalatan, but I think most of the people say Xalatan. Xalatan, only comes in one strength, 0.005%. Really, really tiny little bottle. Only 2.5 milliliters. And the dose is going to be, like 1 drop into whatever eye at bedtime. So the generic name is latanoprost or latanoprost, either is acceptable. It is used for open angle glaucoma, and it's also used for ocular hypertension. There is some special storage before it is dispensed or before the patient uses it. It needs to be refrigerated. It expires 28 days after the patient opens it. So this can turn green, the iris, green eyes, brown permanently. It's kind of wild. Next, we have Buspar 10 milligrams. That's the brand name for buspirone. It is indicated for generalized anxiety disorder, and it takes 2 to 4 weeks for full effect, but there's no dependence issue. So this is a really good drug for anxiety, but the thing is, anxiety is usually something provider wants to treat today because the patient is having symptoms right now. So they often will start with a benzo. But the buspirone is something that's great for maintenance if they can tolerate the side effects. Side effects include diarrhea, dizziness, and often headache. And it's quite common. Next we have Duragesic. I'm going to spell it because it's really hard to see. This is a patch that I found for Duragesic. D-U-R-A-G-E-S as in Sam, I-C. This one happens to be 25 micrograms per hour. Okay, so you can see mg, a little, the microgram /H. So it's fentanyl, and it is a narcotic opioid, and which is also known as a narcotic agonist. It comes in patches that last for 72 hours, and this is really important. When a patient puts one of these on, they need to, at the 73rd hour, there's not much left in it, but it's not just perfect. There might still be some residual. They need to take that off. They can't make the mistake and put another one on. I'm pointing here because this is where it's usually placed. Clear, clean, hairless place, often like the back of the shoulder here, sometimes here in the arm, upper chest, shoulder blades, and that mistake can be fatal, especially if they're on the higher doses. So it's got to come off. When it's put on, a Sharpie if you're putting it on yourself, the patient would do this. They would write the time and date in case there's any question. They can, look at how long ago they put the patch on, because they don't want to leave it. They don't want to take it off at the wrong time because they'll either be wasting it or it won't be effective. So when they take it off, really, really important. They need to take the patch and they need to fold it in half and throw it away. And that is so that there's no accidental poisoning, because there have been reports of a child seeing it and thinking, oh, it's a toddler, and they think, oh, it's a little Band-Aid, and they put it on and they've died. Fentanyl is very dangerous and strong medication. All right, so it also comes in buccal tablets that is between the gums and the mouth, in the mouth here, cheek. Also a lozenge and ampules, little glass vials that you draw the fentanyl out in anesthesia and during surgery. That's where you'll see fentanyl in a hospital setting. So the box warning is addiction, respiratory depression, and accidental exposure. Now, talk about fentanyl for a second. Fentanyl, you've heard about it. It's coming over the border. It's being pressed into pills and being counterfeit sold as Percocet, Xanax, even Adderall, which doesn't make any sense because it's not. Adderall is a stimulant, but from a couple of videos ago, my thought about that. So why do I show an elephant? Okay, so fentanyl is 100 times more potent than morphine. But the elephant fentanyl is called carfentanil, and it's 100 times more potent than fentanyl. And the carfentanil is actually what's coming over the border. They don't call it that. They call it fentanyl, as you know, slang, but it's really carfentanil. You can't even get it in the United States. So when they find it, we know where it came from. Not here. So what is 100 times 100? We say 1 and we add 4 zeros and we have 10,000 times stronger than morphine. And that's why the dust of it can kill someone. And that's why you can't trust a street chemist to dilute that out and press it into a pill and not kill somebody. Or they don't really have weed, so they're just putting some fentanyl in there so that you get some effect. Okay, so 10,000 times more potent than morphine. That's what I wanted to say about that. All right, let's move on to isosorbide mononitrate. I wrote QD down because it is really important. This is once a day dosing. Don't confuse this with isosorbide dinitrate, which is twice a day dosing. So that means this cannot be written as isosorbide 20 milligrams. If you write if your provider writes the prescription that way, pharmacy's going to be calling you, or they better be calling you, and asking, which one is it? Is it the mononitrate? Is it the dinitrate? And you have to go back to the doctor and confirm what it is, because you're looking at it and you see what it says and you can read what it says. The pharmacist can read what it says. Doctor needs to relook at it and decide. So we are not going to assume if the doctor writes isosorbide 20 milligrams once a day, we're not going to assume it's the mononitrate. We're still going to call and verify. That's a regulation. This is indicated for angina pectoris, that is chest pain. It's a vasodilator. All the nitrates do that. They all open the vessels. All right, so we're going to have to monitor the patient's blood pressure. Drug interactions, primarily the big one that we see all the time. Well, we potentially see and we put a stop to it, and the doctors will put a stop to it. But if the patient sees more than one doctor and they don't want to tell the doctor they're getting Viagra from the mail or whatever, this is why education is so important for the patient. That can cause a deadly drop in blood pressure if they're on a nitrate and they're on something for ED, like Viagra, sildenafil, tadalafil, Cialis. Those are the brand names for those. And it's extremely, they get this extreme drop in blood pressure with the combination, and some patients have met their end. So next we have Altase, and this is, guess what? I see Pril at the end. ACE inhibitor, you got it. Used for blood pressure. So same profile as enalapril, lisinopril, etc. So it's going to have the cough risk. It's going to have the potential to increase potassium. That's what K+ is, and the fetal toxicity. But this is a prodrug. That's what makes this one different. So it converts in your body and has a more favorable, even release is what this one's benefit is. Okay, so this is ferrous sulfate. You'll see it's in blister pack. I don't have, there's no brand. You can put iron down as the brand. I chose a picture of blister packing because it really should be blister packed. At one time, it was always blister packed. That was to prevent small children from accidentally overdosing on it because it looks like candy. You know, it's small little pills, easy to swallow. Now you can find them in bottles, and that's because the bottles have, you know, a safety cap. But even so, we could be filling our pill boxes up, whatever. Kids are smart. They could read that it says push and turn. 4-year-olds can, or some 4-year-olds, 6-year-olds can read that. So it's still dangerous to children, but let's move on. The most common strength you're going to see, a doctor is going to order 65 milligrams. Now, when they order 65 milligrams, that's the magic number. It is elemental iron. So I'll show you what that means. Because they can also order as ferrous. That ferrous means iron. Sulfate. Ferrous and sulfate combined, the whole weight is 325 milligrams, but the ferrous part is 65 milligrams. So we see the prescription written in a creative, many different ways. I'm going to show you here. You might see it as iron, 65 milligrams, 1 tablet, PO, Q day. The next one I'm going to show you is identical, but looks different. Ferrous sulfate, 325 milligrams, 1 PO, Q day. That's the exact same order. Now this one's kind of interesting. FeSO4, that is the chemical abbreviation for Fe, ferrous, S with sulfur, and O for oxygen, sulfate, 325 milligrams, 1 PO/Q day. And one more, ferrous sulfate, 5 grains, 1 PO/Q 24 hours. All 4 of those are the same. 5 grains, you need to memorize this, is 65 milligrams. Okay? So, the major side effect to this is going to be constipation and a dark stool. That, for some people, they can't tolerate it. And if that happens, the doctor will often change it to the ferrous gluconate or carbonyl iron. There's some other ones that they can use. But they like this one first because this is the most absorbable and it is available. All right, so toxic and lethal to children who mistake this for candy. All right, so next we have Zanaflex. I'm going to spell that for you. Z-A-N-A-F, like Frank, L-E-X, 4 milligrams. Comes in 2 milligrams, comes in capsules, comes in tablets. Tizanidine is the generic name. This is the last slide, number 100. It's a muscle relaxant. It's used mostly for neurological conditions. So multiple sclerosis, cerebral palsy, spinal cord injuries. Some doctors like it has a little less drowsiness than Flexeril, so they might just use it for regular back pain, but that's what this was intended for. And the way it works is the mechanism of action on this one. It reduces the nerve impulse in the spinal cord. Major side effect, most common side effect is going to be drowsiness. Okay? All right, well, good luck. And that's it. That's 100 drugs.